So today we classify adrenergic antagonists or adrenergic blockers. These are the drugs which will block the alpha and beta receptors, or they will block the effects of adrenaline and noradrenaline on the alpha and beta receptors. And we also call them adrenergic antagonists or adrenoceptor antagonist or adrenoceptor blockers. Alpha and beta receptors, are the sympathetic receptors. So these blockers or antagonists will basically block the alpha or beta receptor and will prevent the binding of adrenaline or noradrenaline to this receptor. And in turn, the biological effects of adrenaline and noradrenaline will be blocked. So they are classified as alpha adrenergic antagonists or alpha adrenergic blockers and beta adrenergic antagonists or beta adrenergic blockers. Let's see what are the alpha blockers. These agents can be further subdivided into these categories, non-selective and selective. And as you know, the selective blockers will block only a single receptor. They will show preference towards blocking a single receptor, whereas non-selective blockers will block more than one receptor. So let's classify them. Alpha receptor antagonists or alpha receptor blockers, subdivided into non-selective, alpha-1 selective, and alpha-2 selective. So they basically block both alpha-1 and alpha-2. They only block alpha-1, and these will only block alpha-2 receptors. The non-selective drugs include phenoxybenzamine, phentolamine, and the alpha-1 selective drugs include prazosin, terazosin, and doxazosin, whereas the alpha-2 selective drug is yohimbine. So let's classify the beta blockers. The non-selective ones include propranolol, pindolol, sotalol, and timolol, whereas cardioselective or beta-1 selective drugs include atenolol, acebutolol, betaxolol, bisoprolol, ismolol, metoprolol, and nebutalol. So they only block the beta-1 receptors present in the heart, and therefore they are preferred drugs for hypertension and other heart-related conditions. Now, there are some drugs in the beta blocker category which have intrinsic sympathomimetic action or ISA activity. Here we have drugs without intrinsic sympathomimetic action, drugs with intrinsic sympathomimetic action, and the drugs with membrane stabilizing action. Now, there are drugs which have intrinsic sympathomimetic activity or action, including pindolol and acebutolol. Now, intrinsic sympathomimetic activity is adrenaline or noradrenaline-like activity by some beta blockers. So such drugs will possess some additional effects, just like sympathetic stimulation caused by adrenaline and noradrenaline. So pindolol and acebutolol with this unique intrinsic sympathomimetic action will not only block the beta receptors, but will also produce some stimulation at the beta receptors. Whereas these drugs are without intrinsic sympathomimetic action, propranolol, timolol, and sotalol, so they will only have the blocking effect and they will not possess adrenaline and noradrenaline-like stimulant effect on the beta receptor. So one of the side effects associated with the beta blockers is bradycardia. So the drugs with intrinsic sympathomimetic activity will produce less bradycardia, such as pindolol and acebutolol, whereas you can prefer these beta blockers in states where the patient has more tachycardia, and therefore you know that propranolol is a preferred drug in case of tachycardias, because it does not possess intrinsic sympathomimetic activity or adrenaline and noradrenaline-like stimulant effect on the heart. Now these are the drugs with membrane stabilizing action: propranolol, oxyprenolol, and acebutolol. Now such beta blockers block the propagation of action potential across the neurons, thereby producing a state of nerve block, and this effect is known as membrane stabilizing effect. So you get an additional effect with these kind of beta blockers. So you might be wondering that what could be the clinical indication of such beta blockers. So membrane stabilizing effect is basically an antiarrhythmic activity. You know that beta-adrenergic stimulation could lead to potentially dangerous arrhythmias, particularly in case of heart pathologies. So such beta blockers will help out in states of arrhythmias or tachyarrhythmias.